Hello everyone, this is a Tioga County COVID-19 Task Force update. I'm Jim Nobles. I am joined today by our Tioga County Commissioners, Roger Bunn, Mark Hamilton, and Eric Coolidge. Let me begin with an update on the spread of the virus. At the time of this recording, which was Thursday, March 26th, there are no positive COVID-19 patients in Tioga County. The task force is very pleased with the social distancing and mitigation efforts of all our residents and employing this to keep this virus at bay for as long as we can. From the surrounding areas, there is one confirmed case in Bradford County, one in Potter County, and one in Lycoming County. And in the surrounding counties in New York State, there are 8 confirmed cases in Steuben County and 1 in Chemung County. While the rest of the state and nation struggle with the spread of this disease, Tioga County, for the time being, is holding its own. The task force can't thank you enough for taking the social distancing recommendations and strict hand-washing procedures very seriously. We are and will remain ever vigilant and prepared as a community to tackle whatever lies ahead. Commissioner Bunn?
Thank you, Jim. The Tioga County Board of Commissioners felt it important that we share some of what is happening in the county in reference to the COVID-19 virus. So today, each of the commissioners, Eric Coolidge, Mark Hamilton, and I, have selected a topic for a short update. Commissioner Hamilton will discuss county emergency services and first responders, along with best transportation. Commissioner Coolidge will address how we are interfacing with state and federal officials and programs. Let me begin by providing an overview of courthouse and county department procedures. As of Monday, March 23rd, all county buildings were closed to the public in response to the COVID-19 virus. Tioga County was forced to make these decisions to protect the safety of our employees and the public we serve, while at the same time continuing to provide needed services. The commissioners have also met with other county elected officials and department heads to develop a flexible strategy that will address work requirements, yet provide a level of safety to the employees. One aspect of this was the closing of all county facilities to the public. Although these facilities are closed, the county is still conducting business. At the courthouse, for example, there are boxes in the entrance area where items can be dropped off for the various departments, and if necessary, a representative of the Office of Interest will meet you at the door to receive items and to answer any questions you may have. Other county facilities, such as Human Services and the Conservation District, are operating at a level required to meet consumer needs, while adhering to the law and conforming to guidance from both the state and federal levels. It is important to emphasize here that no county employees are being forced to come to work. All employees, with the exception of those considered essential, are offered the option of taking vacation and/or applying for unemployment. As most of you know by now, the commissioners have formed a task force of professionals from all aspects of the community to advise us on actions to take, and just as important, to keep us up to date on what actions they are taking to address the issue. Your patience and understanding are greatly appreciated in this unprecedented, trying time. Keep in mind that this is an ever-changing situation. Remain calm, stay informed, and follow the advice and directions of the public health officials. And now I will turn this update over to Commissioner Hamilton. Mark?
Thank you, Roger. Let me start with our emergency management services. Our 911 call center has been locked down for 2 weeks now, with our employees' health and well-being being monitored closely. Our emergency call volume has been slightly down as people are heeding the CDC guidelines for calling their doctors for advice for non-emergency health illnesses. We do need to take this opportunity to remind people not to call 911 unless it is an emergency. More specifically, do not call to report a business that you think should not be operating as a result of the governor's mandate. Our EMS first responders in the field are reporting that they are currently prepared with all personal protective equipment and supplies they need and are making complete sanitation measures after every call. As of 7 a.m. yesterday morning, EMS field protocols have changed to allow for no transport upon patient assessment and communication with both the patient and the medical command doctor. As many of you may know, Tioga County has declared an emergency disaster which will help with drawing down any funding that may become available in the near future. We are encouraging all of our boroughs and townships to do the same if they have not already done so. Our public transportation system, Best Transit, is committed to continuing services throughout this crisis. For the safety of both our drivers and our passengers, we have instituted a free fare for our fixed routes. This allows for no personal contact between drivers and our passengers. We're also trying to maintain the social distancing rules on the buses, as well as sanitizing the vehicles multiple times every day. We have stopped our mall routes and our connector routes, with our Mansfield-Mountie route being reduced to approximately 5 hours per day. Our shared ride route numbers are down as well because of non-essential appointment cancellations. But the staff is still committed to provide all transportation needs in a safe and a timely manner. Northern Tier Solid Waste Authority has suspended all of their recycling for now, but remains committed to all trash pickup routes. Their receiving sites are closed to the public, but remain open to commercial haulers in the area. Again, they are implementing all best practices to keep both employees and the public safe. Eric?
Thank you, Mark. The Board of Commissioners of Tioga County has stayed in constant communication with our state and federal levels of government, as well as the administration of Governor Wolf. There are a number of waivers being requested of the governor, and just recently, nearly 40 have been granted. And those waivers are online, and you can search and find what one program would serve your particular business in our county. Agriculture, I want to express, has been provided with an appreciation of providing the consumer with food supply that is safe and will be made available through the food assistance programs, encouraging volunteerism to help with sustaining those food services to those in need. Supplemental Nutrition Assistance Program, known as SNAP, is available through applications online at compass.state.pa.us. Currently, additional portions are being made available for families in need. I would like to mention, as Representative Owlett stated yesterday, acknowledging the postponement of the primary election to June 2nd, 2020. Our votes will count as of Pennsylvania being a part of an outcome. We are extremely fortunate to have Kex Food Service in our area, who has continued to provide food to their many customers with supplies to meet the region's need. That's an exceptional program, and we're very fortunate. Please communicate with others. There's a need to watch out for scams that are happening. As deplorable as it sounds, they are out there. Spread the word and question what sounds suspicious. Ladies and gentlemen, we will get through this difficult period of time. And when we do get to the other side, please remember our Main Street, those businesses which have kept our community strong, that we support them with our business abundantly. There will be an end to all of this. Thank you for your patience.
Thank you, Commissioners. The task force appreciates all your support and guidance as we work together to address this crisis. Let's close today's update by taking a few questions from our community. Will a mask help me not get coronavirus? At this time, the Center for Disease Control, the CDC, is not recommending the masking of the general public. Social distancing and strict hygiene procedures are what's going to prevent the spread of this disease. We have to ensure that the masks are available for those patients that actually exhibit symptoms so that we can mask them properly in the healthcare setting when they come for care. In addition, we also want to make sure there's an adequate number of supplies for the brave men and women in the healthcare sector that are on the front lines of this disease every day. So the availability of supplies is very important. Next question. When can we get some financial aid here, and how do I sign up for help? That's really a great question. We had a wonderful segment with Kristen Hamilton earlier where she talked about some of the great things we're doing both at the state and national level. The task force is on the forefront of this, and we're briefing the commissioners multiple times a week on when we'll see relief efforts for Tioga County. If you have specific questions regarding the financial relief packages, please reach out to Develop Tioga and Kristen Hamilton, and she'll take the time to answer these in detail and let the small businesses know exactly when the money will be coming in. Is it safe for an older person to go to the grocery store? We know, based on the spread of this disease and the patients that are being affected, that the elderly population is most susceptible. If you have neighbors that can help you with this process, certainly let's all be great Tioga County residents and help our neighbors out. The elderly, it would be advised to stay home if at all possible and maintain that social distancing. Certainly you can go outside, walk down to your mailbox, get some fresh air, but if you can avoid circumstances where there's a lot of people, we'd strongly advise that. Let's all be great residents and help out the elderly in this time of need. Is public transportation safe under the circumstances? I believe we had a great answer to that from Commissioner Hamilton when he talked about everything that BEST is doing now with their disinfecting of the public transportation, the waiving of the fees so money isn't changing hands. So yes, we can use public transportation as long as we maintain the social distancing protocols and make sure, above all else, disinfect your hands. Wash your hands before if you get on the bus. Use the hand sanitizer that you've purchased or you have in your private stash, and disinfect your hands when you get off. So public transportation at this time is safe as long as we maintain the proper social distancing recommendations. All right, let's take one more question before we close out this segment. Oh, this is a great question. I want to be tested for the virus. Where do I go? That's on the forefront of everybody's mind. We can see as the numbers tick up, both at the state level and national level, more testing is becoming available. As we've always professed from the task force, please call your healthcare provider first, and we will advise you of what to do. If you're exhibiting symptoms, we're going to refer you to a testing center in the immediate area so you can be tested. All of the healthcare systems in the area now have the ability to do tests here locally, but we need to have you call the healthcare system first so we can understand your symptoms, understand your exposure risk, and then advise you properly. If you have a question for our Tioga County COVID-19 Task Force, you can email us at covid19questions@thehomepagenetwork.com. We will do our best to answer your questions very promptly. Once again, let me remind you the importance of social distancing and strict hygiene procedures. Together we can and will defeat this virus. And above all else, wash your hands.
The Mansfield Laurel Health Center is now accepting patients in the state-of-the-art Susquehanna Health Medical Plaza at Mansfield. In the same facility, Susquehanna Health is offering physical and aquatic therapy, imaging, laboratory, cardiology, and sports medicine services. For more than 40 years, our 6 Laurel Health Centers have provided high-quality, compassionate care to the residents of Tioga County, offering family-based primary care services, obstetrics, pediatrics, preventive screenings, and diabetes education, as well as outpatient counseling and therapy services. Our passion is to provide comprehensive health care to all who need it with dignity and respect.